All right. Hello, this is Live with Michelle Bam. We talk about health, wealth, and spirituality. And today we are here with Miss Kaylee, and she is from Sedgwick County Health Department. Hello, Kaylee.
Hi, thanks for having me today.
Absolutely. So glad you are here. One of the things we really want to have some conversation around and really begin to re-invite people to think about is the fact that COVID is not gone.
Yes, unfortunately, it's not. Although we've been seeing a lot fewer cases, we still have people who are getting sick, and some people are still getting very sick. So we want to make sure everyone is still aware that it's still here, and they still need to be diligent about protecting themselves.
Yeah. So, Kylie, what is your position at the health department?
I am the epidemiology program manager at the health department.
So for people that are like, she's the what? What epidemiology?
So epidemiology is the study of diseases and kind of how they move through a population. So me and my team are the ones that if you get a reportable disease, so COVID or even like chickenpox or salmonella, we're going to give you a call to try to figure out where you maybe could have gotten that illness, and also help you, stop spreading it from others, and kind of really just protect the community that way.
So as we kind of matriculated, I guess is a good word, through this whole ideal of COVID this year, over the last few years, what did y'all, I mean, it was just like one of those things, we've never seen this happen before in our lifetime. And I know that from the community perspective, it felt like a scramble. How was it for you all?
I would say a scramble is not a bad word for that. We do a lot of preparedness in the health department, where we have plans and we have mechanisms in place that when something happens like COVID, we're not totally taken aback by it. We had been monitoring the situation since late 2019, when it was just a unknown illness in China. And then we kind of watched it move closer and closer. And so we at the health department really kind of started our response to COVID in early March. So well before we had a case.
Yeah. So as you think about that, as you think about the fact that there was something on the radar way before we had any cases here in Kansas, specifically in Sedgwick County, because there were some cases in Kansas City before they were here. What was kind of the response, and how were you all really, I mean, I know, it's coming, but how do you lay out a plan to say, hey, this is what we're going to do? What does that look like?
So we implemented something called Incident Command System, or ICS, at the health department. So we kind of stopped a lot of our normal operations and had everyone kind of focused on COVID. And so we divided the health department up into different branches. So my role at that time was kind of oversee operations. So I was over the epidemiology team, because we were doing not really case investigations, but we were calling people who had traveled to areas that had COVID to, make sure they didn't have any symptoms and that they knew what to do. We are also trying to set up a testing unit as well, which was new for the health department, because we do testing on a normal basis for other things, but mass testing is not something we had ever really done before. We were also establishing a triage line, because if you can remember all the way back then, testing supplies were really limited at that time. So we had to only test people who had symptoms. They had to be certain symptoms. And then we had a lot of people who had questions. This was new for us. It was new for everyone in the community. It was, people were scared. They were concerned. Information was changing all the time because we were learning more and more. And so we wanted to make sure that people had a ability to call and get their questions answered.
So as you think about that, there was this whole piece in which it felt like every day there was new news Every day it was changing. And then we get to kind of where we are now. We get to the place where we're not over it, but things have been lifted. We're not wearing masks. There's not the limitations. So, as things begin to change, how do we get rid of the myths that are out there? Because, there were so many things as we, from the very beginning all the way until now, there are still so many myths, so many misconceptions out there about what is or what isn't, or what we should be doing. Kind of clear that up for us. What is, where are we at, and what should we really be doing right now?
Yeah, so we did have a lot of misinformation that was associated with COVID. And so the best thing that people can do is to go to a trusted source to get information. You can still call the health department. We're happy to answer your questions. You can go to the CDC or the WHO, the World Health Organization, and get information from them as well. But what we're kind of looking at now with COVID is something that has kind of moved into what we call an endemic state. And that means it's going to be here. It's going to be around. And so we expect that there's going to be a certain level of illness related to COVID in the community. And unfortunately, that's probably not going to change. And so even though we're not really actively responding, the public health emergency has ended, we still want people to follow some of those same guidelines that were in place before that ended. So if you develop COVID-19, then we need you to stay at home. The recommendations for that haven't changed. It's still 5 days at home from the date of your first symptom, or if you don't have symptoms, then it's from your test date. And so remain at home for those 5 full days. And then you would want to, if you're feeling well enough, haven't had fever for 24 hours without medication, you can then kind of resume your normal activities, but you still want to wear a mask when you're out for the next 5 days. And that's because you can still spread illness up to those 10 days. You're just more likely to spread it in the first 5.
Right. So should we still be wearing masks?
So that it's a little bit of a kind of a personal decision at this point. If we see a spike of cases in the community, if we see a large increase in COVID, we definitely would recommend that you wear a mask. But we're kind of at a lower level right now. And so it's kind of up to you and kind of how you and your own system is. If you have a higher risk for severe illness, so if you are immunocompromised, have diabetes, heart disease, something like that that could impact how you respond if you get COVID, then you might want to think about wearing a mask, especially if you're in places where you may not know the other people in large groups. I will say for myself, I do still wear a mask when I go into places where I'm around crowds. I still like to wear it just to have that extra level of protection.
I was flying the other day and I was like, oh my God, I don't have a mask. Oh. And it was because it was a lot of people in a very small space. I paid the $5 to get a mask. So yeah, I would agree that's so. As we are looking at, masking still is a thing. We have testing right now is not as prevalent because the funding has gone away for a lot of that testing, but vaccinations are still happening. Why? And I've had some people say, like, I'm on shot number, I don't even know what. Why do I need to keep getting the shots? This doesn't make sense. Something's wrong with that. Help us with that. Because I think that's probably the big thing right now is why should I be getting any more shots if I've gotten, 3, 4, 5 shots? That doesn't make sense.
Yeah, and that is kind of a new concept a little bit. If you think about some of the other childhood vaccines like MMR or hepatitis B, people usually get a couple of those in childhood, and then you don't have to get boosters all along. But then if you think about like the flu, you're supposed to get an annual flu shot every year. And the reason for that, and it's the same with COVID, are those viruses are more prone to mutate. And
Mhm.
so if you remember, the COVID strain we had back in 2019 is not the same COVID strain that we have now.
Right.
And so the vaccines that were designed back for the original COVID strain still offer some protection for,
Mhm.
hospitalization or death against that original strain, but they don't necessarily account for the newer strains, which have been shown to be more virulent, or they can infect more people and spread faster. And
Mhm.
so the updated boosters, and the reason they're updating them is because the COVID strain has been changing. We had the
Mhm.
original, and then we had kind of basically all the way through the Greek alphabet.
Right.
And so they are adjusting based on those changes to make sure that the newest vaccines are the most protective against what's currently circulating.
So then as people are coming in and they're saying, like, oh my God, I don't need another one. What's kind of that date that if you have not had a new booster since when did they kind of change that so that you have the newest version,
Mhm.
if you would?
So the newest booster was actually introduced last fall in 2022. And so that was the kind of the bivalent vaccine, or they call it the updated vaccine. And so
Hmm.
there hasn't at this time yet been a new booster introduced since then. So if you
Hmm.
had that booster then you are as current as you can be on COVID boosters.
Okay.
Now they are looking at releasing a new booster soon, because the COVID virus has mutated a little bit more again. And so
Hmm.
they're anticipating that likely this fall that there's going to be an updated booster. And so when that comes out, we would recommend that everyone go ahead and get that booster as soon as they're able to.
So would that be kind of like when you would be getting the flu shot?
Yes. Yeah, it's actually, that's what I did last year with the COVID booster. I got to the flu shot in one of my arms, the COVID shot in the other. And it was pretty, well, I wouldn't say all that painless, but it wasn't too bad. So they definitely are encourage that, because you can get them both, be protected. And I will say it's very effective. I was around some people who had COVID and I did not get it. And I was very excited about that
Hmm.
because I don't want it. And so they do recommend kind of doing those at the same time if you haven't gotten one or the other yet.
So what are the recommendations for children? We're going back to school, kids are going to be in community. um, we don't know what the fall looks like. There's really not a prediction of what's gonna happen with the fall season coming up, but we do know that colds and being closed in together is always a spreader opportunity. And so what should we be doing with our children?
Yeah, so we typically do see an increase in COVID and other respiratory diseases as school picks up. And then we see another spike again, usually around the holidays when everyone's kind of getting together.
Mhm.
Um, Anyone who is 6 years or older, so that's a lot of children school aged, can get the bivalent vaccine. And so if they have not been vaccinated yet, we're going to recommend that they do that. Um, Anyone 6 months to 6 years can also get a vaccine as well. So again, in that age range, if they haven't been vaccinated, we would encourage that. We always stress hand washing and the importance of hand washing. I
Mhm.
know it's kind of a basic concept that we're all like, yeah, we know that, but it's really important to make sure that you're,
People don't.
yeah, yeah, make sure you're washing your hands really well, using hand sanitizer. Um, Keep your kids home when they're sick, and yourself as well if you get sick. And that's with anything. I know it can be hard for parents to keep their kids home, but definitely make sure that if they're not feeling well, if they have a fever, if they've got any kind of cold symptoms, keep them at home. Um, there still are at-home COVID tests that you can do.
Mhm.
And so if you have symptoms, your kid has symptoms, you can do a test to make sure that they don't have COVID, but they might have something else. Strep throat has been kind of going around a little bit. We had an RSV spike. I believe that was last year. We've
Mhm.
got flu every year. So just making sure that they're staying home when they're sick.
So if there was besides just staying home, if there was anything if somebody was saying, hey, what is the one thing that I can do? I'm washing my hands. I'm masking when I go out into public. I'm, trying to stay away from people that I know have COVID. What other things are there? Supplements? Are there other things that I could be doing to boost my immunity, to make sure that I have, for lack of a better term, a blanket, a bubble around me so that I can be safe through the winter?
There's been a lot of discussion and talk around, taking different supplements to protect you from COVID or other illnesses. And kind of our response at the health department has really been that there's nothing really proven that would do that. And so we would encourage you to talk to your doctor. They're going to know your health the best. And so they can talk through with you, here's what we would recommend for just general health. Here's things that probably don't make sense. And especially if you're on any kind of medication, because different things can interact with that. And so I would say, if you're concerned about that, kind of want to think about something, then talk to your healthcare provider.
Thank you so much. We appreciate all that you all are doing and the ramp up that you did. We could see from the community that you were really, really putting in the effort to make sure that we had COVID information, that we had COVID testing, that we had COVID vaccinations available within our communities. And so with that, we just want to remind everyone that we do have vaccinations, that we do have immunizations, that we do have various health forums that will be coming up. Are you all doing any things in the fall? If they're looking at your website, are they being able to find places that they can get immunizations, vaccinations, things of that nature?
Yeah, so we're not at this point planning any kind of large mass vaccination events, but anyone can call the health department right now. Our main number is 316-660-7300. And they can make an appointment to get a vaccination, the COVID vaccine of Pfizer or Novavax. And that's regardless of insurance. And that is at no cost.
Thank you. We appreciate you, and we appreciate you coming on today. Have a good day. This is Live with Michelle Van, where we talk about health, wealth, and spirituality.